invite us, STMCA would be to take over the session. Welcome to you, sir.
The next is Adhata Pratishyay Pratishedham Vyakhyasyaamah Yatha Bhagavan Dhanvantarihi Nari Prasangaha Shiraso Abhitapaha Dhumo Rajaha Shitam Atipratapah Sandharanam Mutra Purishayoscha Sadyat Pratishyaya Nidanamuktam. Pratishyaya is the very common cold conditions which are also named as upper respiratory irritations or upper respiratory infections many times, or the coryza and so on. The different names are there, and it's a common condition, and the causes for them are, as per Sushruta, Nari Prasanga, sexual activity, then Shiraso Abhitapaha, heating the head or exposure of the head and the nose to smoke or dust or extreme cold, or even Vegavidharana, suppression of the urges of micturition as well as the stools is considered to be the etiological factors, Nidana for the Pratishyaya or common cold. The pathology is described as Jayangataha, Murdhani Marutadayaha, Prasak Samastash Taseva Shonitam, Prakopyamanaha Vividhi Prakopanehi Nradam Pratishyayakaraha Bhavantihi. The vitiated doshas, Vata Pitta Kapha as well as Rakta, which are located in the Murdha, the head area, head and neck area, when they get aggravated due to any of the triggering factors, that produces the Pratishyaya or the cold. The major common clinical symptoms of the Pratishyaya are Shirogurutvam, Kshauthoha Pravartanam, Tatha Angamardaha, Parihistaromata, Upadravaschapi, Apare Pratagvidaha, Nadam Pratishyaya Purasaraha Smritaha. The common signs of upper respiratory infections are headache, sneezing, and the general body ache, and maybe the erector pili or the erections of the hairs, general debility, and as well as other complications. Now, clinical symptoms of each variety of the Pratishyaya is described later as such. Now, from the current point of view, upper respiratory tract infections or upper respiratory tract inflammation, any of that word can be used, represents the most common acute illness, which ranges from the common cold, typically a mild self-limited catarrhal syndrome of the nasopharynx, to life-threatening illnesses such as epiglottitis. The common terms which are used depending upon the location of the inflammation are rhinitis, which is suggestive of inflammation of the nasal mucosa, rhinosinusitis or sinusitis when the inflammation spreads to the paranasal sinuses, frontal or ethmoid or maxillary or sphenoid sinuses. Then nasopharyngitis is or rhinopharyngitis or the real common cold, which is very common. The nasopharyngitis is the most common variety where inflammation of the nose, pharynx, hypopharynx, uvula and tonsils. They are widespread upper respiratory tract as such. Pharyngitis is when the inflammation is limited to the pharynx. Epiglottitis or supraglottitis is when it is in the superior portion of the larynx. Laryngitis is inflammation of the larynx. Laryngotracheitis is when there is a part involvement of the larynx, trachea and subglottic area. Tracheitis is when the trachea and subglottic areas involved. These are all the different names given based upon the clinical presentation, but the pathology is the same. It's only these names only suggest about the extension of the inflammation area and location of the area as such. The common causes of the upper respiratory infections as per the present day's version would be either viruses or bacterial or allergic. The viruses, the very common viruses are the rhinoviruses, coronaviruses, adenoviruses, coccidiovirus. Of course, coronavirus, the COVID which was there also is one of the similar issue, and the virility of these organisms would vary, as well as the clinical presentations also can vary depending upon these organisms. These usually viral organisms would occur as an endemic pathology. Usually they tend to spread from one to the other, and they tend to occur seasonally, and they tend to spread rapidly. Virulence of these organisms also would vary from season to season. In some seasons it would be very virulent, in some seasons very less virulent, and as such. Then bacterial causes are either streptococci, common or streptococci, and A or C and G variety. And in children particularly, 20 to 30% of the children, streptococci are the common causes. And Neisseria gonorrhoeae, then Archaeobacterium or Corynebacterium, diphtheria or Corynebacterium hemolyticum. Corynebacterium diphtheria is almost now is absent now, or rather it's almost abolished, like because of the immunization. Then atypical bacteria like Mycoplasma pneumoniae or Chlamydia pneumoniae or anaerobic bacteria, rarely they do occur. Then another major group of these are allergic onset respiratory infections as such. Now, as far as the incidence is concerned, from India, in India, the most common sort of this organism is influenza A virus, which is most common. Of course, this data is of 2020. Now, after the corona has come up, the data may slightly change. These changes may change. Like rhinovirus is the next common, and Chlamydia pneumonia are the least common in India. Of course, depending upon the these geographical zones, the incidence may vary. And from Indian point of view, influenza A is the most common one, and hence when it comes to the question of immunization, the most common this vaccine given is influenza A, that vaccine. The relationship with the season also is quite common. Now, the most common these incidents would be in the rainy season, July, August, September. This is the usual incidence. But of course, these days that tendency has been changed. Like you get these epidemics, or rather episodes of this inflammation in almost every season. Most of the times it will be like school-going children when the school starts, like usually in the month of June or May or so on. The incidence will be like more, and then again there will be a slight diminution as such. But as per the data, the type of viruses related to the season also are well established, like, but these again can change. These factors also can change, but in general, in India, the incidence is more common in rainy season, July and August, whereas in other countries the season may change, but in total the incidence of common upper respiratory infections will be almost as high as around 8% of children having 8% of the children would be always absent from the school throughout the globe, as per the, and due to the upper respiratory infections as such. This is the data given by the WHO. Now, as far as the clinical presentations and variations of these Pratishyaya, the Vataja Pratishyaya lakshanas are Anandha, Pihita Nasa, Tanusrava Pravartini, Gala Talu, Vashashoshascha, Nistodaha, Shankhayostrada, Saropaghatascha Bhaveda Pratishyaya Anilatmake. In Vataja variety of the Pratishyaya, the clinical symptoms will be like there will be a nose which becomes irritated, and there will be thin discharge, thin watery discharge, and there will be a dryness of the throat, palate as well as neck, or maybe pain also, or even pain in the temporal area, and voice being changed, Saropaghatha, voice being changed. These are the typical signs of Vataja variety of the Pratishyaya. Now, when you see the patients, this is very typically seen. These variations are clinically identifiable, and many of the times it may be either related to the location of the inflammation, or it may be related to the type of the bacteria, now, or type of the organism, virus or the other organism. Now, from the clinical point of view, exactly the Vataja lakshanas are seen in when patients have either epiglottitis or laryngobronchitis, like that inflammation is limited to the lower part of the throat, epiglottis or larynx. Then you will see exactly the same clinical symptoms, like in a typical epiglottitis presentation will be sore throat, there will be salivation and pain during swallowing, or a feeling of lump in the throat, or voice may be changed, like dysphonia or loss of voice could occur, dry cough or no cough. At times there will be no cough. Dyspnea may be the presentation symptoms. Fever, fatigue or malaise may be seen with any upper respiratory infection. This is not only common for epiglottitis. And sniffing posture. The patient would always have a bending forwards position. These are the typical features of epiglottitis, and this matches with the exact description of the pathogen Pratishyay mentioned by Sushila. Or the similar symptoms also occur in laryngobronchitis, where there will be a involvement of the deeper area where the swallowing may become more difficult and painful, and they may have that exact sensation of lump in the throat. And when you auscultate, there could be some the involvement, these additional sound, adventitious sounds which may look like ronchi. Then typically the Pittaja variety of the Pratishyaya, Ushnaha, Savitakah Sravo, Granat Sravadipaitike, Krusho Atipanduhu, Santapto, Bhave, Trushnani Piditaha, Sadhumam, Sahasavane, Momatibajamanamaha. In the case of Pittaja variety, there will be yellowish discoloration from the nose, and the patient would have very high fever or comparatively high fever, burning sensation throughout the body, and the patient will feel that heat, feel the heat in the nose as if the whole body is vomiting out the fire. So, and the patient would be very weak. Physical symptoms, systemic symptoms are quite high. This is very typically seen in streptococcal pharyngitis. Now, in the present season, you have streptococcal as well as Coxsackie virus. Now, in the present season, like last month, December, as well as in the January, we had a almost large number of patients with the Coxsackie virus and streptococcal pharyngitis. And the clinical symptoms are exactly the same, like erythema, swelling or exudates of the tonsils or pharynx. There will be patients who have pain in the throat, and the tonsils or pharynx will be quite inflamed. Even there could be yellowish discoloration seen over the area. Temperature is quite high also, and the patient may have the lymph nodes in the neck palpable. Characteristically, there is compared to lesser nasal discharge. Nasal discharge is lesser. Cough also is lesser, and only in the later part there could be the issue of the cough presentation. That's exactly the Pittaja. Majority of the patients whom we see in this month, like January to March, would be of Pittaja variety, quite commonly in our conditions. Then Kafaha Kafakrite Granat Shukla Shita Saven Muhu Shukla Bhasa Shunaksho Bhave Guru Shiromukaha Shiro Galavasatalu Nam Kanduyanam Ativaja. In the Kafaja variety, there will be thick whitish discoloration, whitish discharge coming through the nose, which is comparatively not so high fever. There will be no high fever, and the patient may have a headache, more of heaviness in the headache, and itching over the area, the shiro, gala, etc. In the neck and head area, there could be itching. Now, this is very common in case of the adenovirus nasopharyngitis, adenovirus induced conditions. Last year, of course, even in case of the coronavirus, COVID-like conditions, the initial clinical symptoms will be the same. Like there will be initial nasal mucosa, it's limited to the external nose, external part of the nose, and the anterior nose is initially involved, so there will be initially irritation in the nose, there will be reddish coloration, then there will be discharge from the nose, which is characteristically thin as such, or then later it becomes thicker as such. Then initially it's thin, particularly in viral conditions. Later on it becomes cloudy, white, yellow or green at times, depending upon the color of the dish. Smell may be affected, there could be foul breath also. Fever, comparatively low grade fever, but it may present with the fever also occasionally. Now, most of the times we get this kind of presentation in the rainy season here in our area. Majority of the patients who come with the upper respiratory infections in the rainy season, they come with these varieties. Now, once this occurs, it results in the complications would be, if the Pratishyaya occurs repeatedly, then it results in a complication called as the Pinasa. Bhutva Pratishyaya यो अकस्मात् विनिवर्तते सम्पक्को अपि अपक्को वा सर्वप्रभव स्मृतः लिंगान् चैव सर्वेषां पीनसानां च सर्वजे. A tridoshaj variety would be having a patient would have repeated episodes of the upper respiratory infections, which results in the continuous permanent changes in the tissues, and that condition is what we call as atropic rhinitis. Atropic rhinitis is that condition which is the tridoshaj variety of the upper respiratory infections. Now, atrophic rhinitis usually is categorized or identified with the changes in the epithelium of the nose, and the patient would have a continuous clinical symptoms. Then Raktaja variety, Raktaja to Pratishyay, Raktasravaha pravartave, Tamrat sashta bhavet jantuh, Uroghat prapiridaha, Durgandha, Uchvasavadanaha, Tatha Gandhanna Betija, Murchanti Chatra Krimeha, Shwetaha Snigdaha Tata Adavaha, Krimimurtha Vikarena Samanam Chasalakshanam. Raktaja variety of the Pratishyaya would present with the persistent cough, or even there could be some hemorrhaginous condition. Bleeding also can occur, and there would be pain in the chest because of the cough. The patient's eyes will become reddish. There will be foul smelling breath also, and smell also is not affected. Of course, smell being not being affected is also another of the feature of the coronavirus like conditions. And the patient would have even krimi or some these visible krimis or maybe worms or so on may be seen in the area. Now, this kind of a presentation may be what we see as the whooping cough or pertussis, or of course in any other upper respiratory infections which is quite virulent. These conditions can be seen as in any virulent conditions, or the patients who is compromised are more characteristically what we call as whooping cough or pertussis. Typically in the whooping cough, the identification, clinical identification is that classical whoop sound during the coughing, due to inspiration, deep inspiration at the area, and it's common in children, and it occurs as a paroxysm of the cough, and usually it presents with the three stages, three phases. Initial first 7 days catarrhal, where it will be presenting with exactly upper respiratory symptoms. Then it becomes that periodic cough, where it's usually around 1 to 6 weeks, and then there will be convalescence. Next 7 to 10 days there will be a gradual recovery. That's the clinical presentation as such. Now, as far as the complications are concerned, one of the complications as well mentioned is either it can become tridoshaj because of the repeated one, or Sushruta describes the consequent changes as such. That Sarvaja variety which we have discussed earlier, as well as the complications which are considered Dushta Pratishyaya or Pinasa. Now, Sushruta has named the word Pinasa in the condition where there is a tridoshaj variety, or the Dushta Pratishyaya is the other word given to a similar complication which can occur due to the repeated persistent upper respiratory infections. Now, in the upper respiratory infections of this, Prakalipjati Punarnasa Punascha Parishushati Muhu Anahyate Chapi Muhur Vibujate Tatha Nishwasa Butchwas Daurugandhyam Tata Gandhanna Vetija Evam Dushta Pratishyayam Janiya the Krisasadharam. It becomes chronic and it becomes incurable due to a persistent discharges from the nose, and then the nose may become dried up later on. Either there could be continuous discharge from the nose, or the nose may dry up, and there will be even distension of the nose. The nasal tract would be affected. The pattern of the nasal tract would be affected. It becomes distended. Muhu vibriyate, even it becomes widened. But though it becomes widened, it results in what we call as a paradoxical difficulty in breathing. The patient would not be able to take the air in properly because the shape is altered, and there will be nishwas uchchasadaur gandhyam. There will be a foul smell in the breath, and the patient also would not be able to feel the smell. Now, this is exactly the clinical presentation of atropic rhinitis. Now, or it's also known as vagina. Now, atropic rhinitis, either it is the Pinasa or the Dushta Pratishyaya, which is a complication of the Pratishyaya. They are almost similar. Clinically, when we characterize the atropic rhinitis, it's characterized by the mucous membrane being sclerotic, where when you look at the mucous membrane, you can see the changes, like it becomes somewhat opaque, that shining appearance is lost, and there will be even viscous, thick secretions and foul smell as such. And widened nasal cavity also can produce the obstruction to the nose. Now the other complications, which also are called as penasa vaisushruta, are sarvaiva pratishyaya narasya apratikarinaha kalena rogajananaha jayante dushtapenasaha bhadhiryam andhyam aghranam ghoramscha nayanamyan kasa agni sada shofascha vruddhaha kurvanti penasaha. The same complications, penasa or chronic atrophic changes, can result in the complications like they may produce multiple disorders like badhirya, impairment of the hearing, andhya, even vision could be affected, aghranam, there will be a permanent loss of the smell, or any other serious eye diseases, continuous persistent kasa or cough, then impairment of the digestive capacity, even generalized swelling also can occur. Now, a patient who has a chronic repeated respiratory inflammations, or what we call even allergic pathologies, which results in atrophy, and the same results in a anterior part of the nose becomes quite significantly inflamed, and the septum also becomes wider, and that condition is also named as rhinitis sicca. Now we use the word rhinitis sicca. Any upper respiratory tract infections can result in complications which we see quite frequently in the clinical condition. See, usually upper respiratory tract infections are considered as self-limiting, and most of the times they would be healing within 1 week. But at times they can result in the complications, and the other complications which can occur could be sinusitis, otitis media, the hearing loss impact as suggested by Susila, laryngitis, persistent difficulty and chest pain as tracheobronchitis, even pneumonia, severe respiratory infections could occur. Fatal complications also can occur, though rare, they are very rare, but fatal complications also can occur where the patient may have a generalized sepsis, meningitis or intracranial abscess, or acute respiratory failure conditions, as in case of the COVID. COVID had that many fatal conditions, and typical presentation of the COVID also was it would be relatively milder in the initial few days, then all of a sudden the condition becomes aggravated, resulting in respiratory failure. From the clinical point of view, whenever a patient comes to you with the upper respiratory signs, it's quite important to define whether it is really a viral, bacterial or allergic. Now, the viral is influenza-like symptoms. Upper respiratory infections due to the bacteria are the usual conditions. Now, from the clinical point of view, the common, of course, there will be a lot of variations from this, but in general, easy, simple method of differentiation would be when the patient has itchy, watery eyes as a presentation. It's more common in allergy. In case of the bacterial infection, it's compared to less common, but in adenovirus conditions, it may present with even the conjunctivitis like conditions. Influenza, it may have a more sort of symptoms behind the eyes, headache, and the patient may feel the pain behind the eyes, and at times conjunctivitis. Nasal discharges and nasal congestion are common in almost all the three varieties. Sneezing is most common in allergy, very common in the infective pathologies, bacterial infective pathologies. Virus conditions, sometimes it may be presented. Sore throat is more common in bacterial pathologies, whereas in the viral pathology is less common, and even in case of allergy it is usually less common, but occasionally when the patient has postnasal drip, there could be some sort of sore throat, but when you look at the throat, it may not show that inflammation changes. Cough in allergic pathology is less common, whereas it is common in the bacterial as viral pathologies. Now, the other important part is majority of these symptoms are the kaphaja symptoms. Now, the symptoms like fever, malaise, fatigue, these are the pittaja symptoms, and based upon that we can make out clinically what is the pittaja kaphaja. In case of the allergic pathology, the facial pain, headache is common, and again in viral pathology is common. Bacterial pathology, headache is less common. Fever in case of viral pathology, this allergic pathology is almost non-existing. If the patient doesn't have the fever, and in case of viral pathologies, it's a very common and usually high degree of pathology. Malaise also is common. These are the pitta symptoms, and maybe myalgia, fatigue. These also are the vata symptoms. So the important is, by looking at these symptoms, we can make out which of the patient is vataja, pittaja, kaphaja. Now, as far as the treatment protocol is concerned, according to Sushruta, Navam Pratishyayam Apasya Sarvam Upachare Sarvashayava Panehi Svedehi Vichitrehi Vamaneshchayuktehi Kalopapannehi Avapidanescha. Except in Nava Pratishyaya, that's first 1 week, Ghrutapana is not to be given. If the patient presents with the Pratishyaya after a week, Ghrutapana is suggested as one of the treatment. Svedana, and Svedana could be modified as per the need, like you may take the steam inhaled acid, or maybe local fermentation with the warm cloth or so on. Vamana or Avapidanasya are the major protocols of the treatment suggested by Sushruta. Apachyamanasya patanartham svedo hito amblehi ahimam cha bhujyam nishevyamaanam payasa ardrakam va sampadiyet ikshu vikara yogehi. The other common prescription is the svedana is given with the warm substances or warm food is given, and one of the common is milk and shunthi, the ginger which is prepared, shunthi kshirapaka is one of, with the this sugar, ikshuvikara, sugar or jaggery is one of the common prescription which could be done given in such conditions. Then pakvam ghanam chapi avalambamanam shiro videkehi apakashetam virechana asthapan dhumapanehi apeksha doshan kavalagrahescha. Once it becomes pakka, that means the discharges have become semi-solid or sticky, and the clinical symptoms of acute fever are reduced, but the patient has persistent symptoms. That in such conditions, shiro virechana dravyas, virechana can be done. Nasyas, which are shiro virechana, could be given, and asthapana, dhumapana, virechana and kabalagraha, these are the other suggested treatment. Nimata shayyasana chestanani murtham gurushnam tathaiva pasaha tikshnaha virekaha shirasas sadhumaha ruksham yavarnam vijayacha sevya. The patient should be kept in a warm room, and where there is no open ventilation or free movement of the air. The head should be covered and kept warm, and the patient also should use warm clothes. Virechana is suggested, and the yavarna, food with the light food like yavarna, and haritaki are suggested as the contents of the food. Shitambu, Yoshita, Shiravagaha, Chinta, Ati Rukshashana Vegarodhan, Shokancha Madhyani Navani Chaiva Vivarjayat Pinasa Rogajustaha. A patient with the pinasa or chronic rhinitis conditions should avoid cold water, should avoid sexual activities, should avoid taking bath over the head, and since worries, psychological stress also has to be avoided, and rukshashana, all junk food has to be avoided, and vegarodha, all the physical activities should be maintained properly. Madhya, alcohol also has to be avoided, and new food or navadhanya, the food prepared out of the grain which is grown in the same season, should be avoided. Then some of the specific treatment are Charji, Angasada, Jwara, Gauravartam, Arochaka, Arati, Atisarayaktam, Viranganihi, Pachana Deepanihi, Upachare, Pinasinam Yathavata. Langhana is suggested when the patient has symptoms like Charji, vomiting, Angasada, pain over the body, Jwara, Gaurava, and Arochaka, Atisara. In these conditions, they have to manage with the Langhana. Or Pachana Deepana Pachana Aushadis. Bahudravaihi Vata Kapopasystem Prachardayet Pinasinam Vayastam Upadravam Stapi Yathopadesham Swabheshirihi Bhojana Samvidhanihi Jayet Viditva Mrituram Gadeshu Praglakshaneshu Uktam Atha Adishetya. In general, the patient has to be given more water, and then vomiting, maybe vamana has to be induced if the patient is otherwise healthy, and all the other complications when they occur, they have to be treated as per the clinical symptoms. Symptomatic treatment has to be given, and in all those conditions where the patient would present with symptoms as such. वातिकेतु प्रतिष्ठाये पिबेत् सर्वैः यथाक्रमं पञ्चभिः लवणैः सिद्धं प्रथमेन गणेन च नस्यादिषु विधिं प्रश्नम् अवेक्षेत अर्जितेरिदम्. Now, in the Vatika Pratishyaya, where the patient would have pain in the throat and the hoarseness of the voice, such conditions, Ghrita has to be given with the Panchalavana as well as the Aragvadadigana. Nasya also has to be given, and Ardita also. Even the patient with Ardita, all the treatment protocol of the Ardita can be applied in Marpaja variety. पित्तरक्तोत्थयोः पेयं सर्पिं मधुरकैः श्रुतं परिषेकान् प्रदेहांश्च कुर्यादपि च शीतलान् श्री सर्जरसपत्तङ्ग प्रियङ्गु मधुशर्कराः द्राक्षा मधुरिका गोजी श्रीपर्णी मधुकैः श्रुता युज्यन्ते कमलाश्चात्र विरेको मधुरैरपि. In the Pittaja and Raktaja variety, where the patient would have high fever and the systemic symptoms, Madhura Dravyas have to be given, and local Madhura or Shita Pradeha also can be applied over the area so that the fever comes under control, and the patient is given Kavala with Draksha, Madhulika, etc. Dhava, Tvaka, Triphala, Shama, Tilvakaihi, Madhukenacha, Sriparni, Rajani, Mishri, Kshire, Dashagune, Pacheta, Tailam, Kalopavannam, Tannasyam, Syad, Anayohitam. A Nasya prepared with the Triphala, Shama, etc. They can easily suggested in Pittaja variety. Kaphaje, in the Kaphaja variety, Sarpisha Snigdham Tila Masha Vipakvaya, Yavagua Vame Dvartaha, Kavagnam Kramamachareta, Ubhe, Bade, Brihatyocha, Bidankam, Satrikantakam, Shweta Mulam, Salabhadram, Varshabhum, Chatrasamhareta, Tailam, Ebhir Vipakwam to Nasyam, Asya Upakalpayeta, Sarala, Kinihi, Davo, Nikumbhengudihi, Imudibhiskudaha. Vartayascha upayajyaha syudhumapane yatha vidhi. In the Kaphaja variety, initially the patient has to be given snehana with the tila masha prepared ghrita, and vamana has to be suggested. Vamana has to be given after giving snehana with the ghrita processed with the tila and masha, and the other drugs which can be used in the form of dhumapana. For the dhumapana, Varti has to be prepared with the Bala, Atibala and Bala, and Brihati, Bidanga, etc. These are for Nasya. Bala, Brihati, Bidanga, this Gokshura, Shetamula, these are used for the Nasya. And Sarala, Kinihi Daru, the drugs like Sarala, etc., they are used for the Dhumavana. सर्पेंशि कटुरिक्तानि तीक्ष्णधूमाः कटूनि च भेषजानि उपयुक्तानि हन्यः सर्वप्रकोपजं रसान्यने च साकिभिषे मुस्तायां भद्रदारुणि तैलं विपक्वं न स्यात् विदद्यात् छात्रबुद्धिमान्. Ghrita prepared with the katu dravyas, tikshna dravyas, as well as in Tridosha variety, these are used as such. Then Rasanyana, Ativisha, these are also used in the as a nasya in the Tridosha variety or pinasa when it becomes chronic. Mustra, Tejavati, Patha, Katpalam, Katukavacha, Sarshapaha, Pippali Mulam, Pippalyaha, Saindhavagnikau, Tutham, Karanjabijam, Jalavanam, Bhadralarja, Yeti, Kritam Kasayam to Kamale Samprayajeta, Hitam, Mudhavireketu, Tailam, Ebhi Vipachitam. Again in the same chronic pinasa conditions, that there would be atrophic or persistent conditions. The drugs prepared out of Thaila prepared out of Mustra, Tejavati, etc., they can be given in the form of Kavala, gargling. Kshiram Ardhajale Quatim, Jangalehi, Mrgavakshibhi, Pushpehi, Vimishram, Jalajehi, Vataknehi, Ushadirabi, Hime, Kshira Vasishte, Asmin, Grizam, Utpadyatnataha, Sarvagandasilan, Ananta, Madhukam, Chandanam Tata, Avapya Vipached Bhuyaha, Dashakshiram Chatadgridam, Nasye Prayuktam Udriktan, Pratishayan Vipohati, Yathastum Doshamanehi, Tailam Kuryachayatnadaha. Another of the tail which is prepared with the Jangalamamsa, Mrigamamsa, etc., the flesh of these animals with the flowers as such, and the other drugs which is prepared with the Kshira, and from that Kshira, Ghrita is prepared, a complex method of preparation, and then it has to be added with all the sarva gandha dravyas, chandana, etc. And it has to be prepared in the form of ghruta, which has to be given in nasya, very complex form of preparations. Samutra pittascha buddhistah kriyah krimishu yojet yapanartham krimignani beshajancha buddhiman. For the prolonged or suppression of the symptoms, Gomutra or Gopitta or any of the Krimigna yogas could be used in the Krimija variety. As well as the practical clinical applications are concerned, when I treat the patients of upper, which are quite common, if the patient has upper respiratory tract infections like epiglottitis, pharyngitis, etc., as I told you earlier, we can easily differentiate the Vataja, Pittaja, Kaphaja lakshanas in these conditions. My prescription would be Mrityunjaya Triphala Gupta Amrita, comparatively simple prescription, easier prescription compared to what Sushruta has suggested. I am not saying that all the protocols of treatment in Sushruta are not necessary, but we can manage with relatively simpler prescriptions, which also is quite important. In Pittaja variety, usually my prescription will be Mrityunjaya Arogyavardhini Amrita. Kaphaja variety, my prescription will be Mrityunjaya Triphala Amrita. And Pinasa, when it becomes chronic and either atrophic or in cases of allergic conditions, my prescriptions will be Mrityunjaya Laghushekara Amrita Nutela. Majority of these conditions can be managed with these simple prescriptions satisfactorily, and the results are much better than the contemporary system or medical practices used. Now, it looks like when Sushruta has suggested about the different complex protocols of the treatment, it looks like it is unnecessary. But if you look at the current situation, WHO has released a major document about principles of the management of cough and cold, and it's a huge document which deals with all the other issues. I have just copied a last part of the tables of the drugs and remedies used for cough and cold and by pharmacological category. Now, I have just copied it just to show like the variety of the options of the treatment which are suggested in the current situation, and I have copied it from WHO document which is universal, which is applicable to all over the world. See the variety of the options of the treatment. The first is antitussive, is given in the form of a table. The antitussive agents, again the antitussive agents either centrally acting, opiate derivatives, then dexamethasone, non-narcotic like carbendazole, then the aromatic topical antitussives which have a smell like camphor, menthol, eucalyptus, steam inhalation antitussives which can be given in the form of steam inhalation, again eucalyptus or thymol, turpentine, etc. The substances which you can clear the thick sputum, expectorants like ammonium chloride, ammonium carbonate, beechwood, creosote, benzoin, etc., which is to clear the thick sputum. Then expectorants which are other terpene hydrate also, which can be used as an expectorant acid. Mucolytic drugs to reduce, make the thick sputum as thinner, acetylcysteine, bromhexine are used. Then mist is another therapy which is suggested. Mist is something like nebulizers, like where you will use the fine particles of this water. Then nasal congestion with other cold symptoms by any of the other drugs like sympathomimetics, nasal drops like phenylamines, desoxyphenylamine or ephedrine also. Then antihistamines is the other group of drugs. Again, there could be either first generation drugs like bromphene maleate or the ethanolamines or ethylenediamines or piperazine, cyclizine, or it's a second generation like estimazole. Now these days it's a commonly prescribed drug in modern medicine. Then second generation like loratadine, ezolastine, anticholinergics like atropine, belladonna, saline nose drops, hot fluids for the relief of sore throat, demulcent or soothing remedies like syrups, lozenges, and topical anesthetics like benzocaine. So the issue is the options of the treatment suggested in the document is quite enormous. It looks like almost every variety of the drug can be used in the management of common cold. But practically, majority of these common cold conditions do not require any energetic treatment. All that could be simple rest and dietary regulation. That's having that low calorie diet and bed rest would be enough in managing many of the conditions. Maybe simple medicines like Mrityunjay Aragardin would be enough. But you always have to be careful for watching for the complications. Complications do occur only when the patient doesn't follow the proper care, like about the diet and about the exercise. Warm water is the best of the possible option of the treatment, or maybe the shunti is the other best of the option of the treatment in majority of the conditions. And as far as the immunization is concerned, another of the issue, now these days it has become a fashion, like vaccines are being given for a large number of viruses. Influenza viruses are also now given. But what I have observed is the real value of these vaccines also is questionable. Majority of the people who have taken the vaccines would have some other virulent virus which would be more troublesome than the common what we call as nosocomial inflammation. See, nosocomial infections are those which are present in the society and a person tends to get affected by the infection over there. Patients who are given these vaccines, they may become immune to those infections, but some of the mutant variety of the viruses which are more virulent than otherwise, they tend to occur in such patients, and the treatment will be always difficult in such persons who are immunized. That's what I have observed. Of course, from the official point of view, this kind of issue is not recorded anywhere in the medicine. So what I am saying is purely my version there. I am not giving that generalized medical version. As for the medical data available, if these vaccines are useful in reducing the incidence. Anyway, that's about the common cold. With this, we conclude the present chapter. Iti Suksuksamidayam Uttaratantrantarte Shalakyatantare Pratishyay Pratishedho Nama Chaturvimshatitamo Adhyayaha. If there are any questions, we will try to answer and then wind up. Right, there are no questions, so we will wind up.